Good day to you all. This is Good Day Twitter. I'm in the person of Fajima Derek, and then we are going to continue from where we left the last time in our previous video. And it happens to be that we reach the some of the overview of some personality disorders. So we are going to talk about obsessive compulsive personality disorder. So with this disorder is its description is like it's pervasive pattern of preoccupation with orderliness, perfectionism, and then mental and then interpersonal control. So with this, their behavior is like they are obsessed with rules, schedules, and details. You get it? So they are often like the people that they think that they are the only people that can do things right and then attain perfection. Are we together? So that's about this obsessive compulsive this personality disorder. And then one thing about it is like they are often excessively devoted to work and productivity to the exclusion of leisure and friendship. So since they are much focused on what they are doing, like their work and productivity, they don't include the aspect of valuing relationship and friendship and also getting time to rest. So that's why I said initially they are obsessed with rules and schedules. Are we together? And then they lack emotional expressiveness, like how to express themselves emotionally. They lack it. According to these obsessive compulsive personality. And then with that you have to one thing that you have to note about this is you see with this obsessive compulsive personality disorder, it's something like of a consistent control. Maybe they have some consistent control over what they are actually doing. So maybe in case someone is in charge of at maybe in case someone is in charge at a workplace for a certain department. You see, instead of you working and also taking time to monitor your leisure, your relationship, they don't do that. They are often much more into that's why we call something like obsessed. They are obsessed with what they are doing. So they don't have time to value friendship and relationship. Are we together? Yes. So right now we then move on to the causes of personality disorder. So that's why when someone move out from the normal way that they are doing their things, that disordering, you have things that causes that. So right now we have the genetics. We believe that personality disorder is not always about something that it has to be something that we learn, but it can also can be from the genes, especially something like anger issues. You see, there are times that in a family, someone be like, "Oh, this family, this anger issues runs through their genes. Like everyone gets angry easily." You get it? Yes. And then we have the brain structure and then function. So with the brain structure, you see how the structure of like how your brain functions can also causes some kind of personality disorder. And then we have childhood experiences. You see, in our childhood experience, it happens to be that there are others that will experience some kind of trauma, neglect, and then these experiences affect how these people actually do things when they grow into an adult. You get it? And then we're having the environmental factors. You see, when you're talking the environmental aspect, you're talking of the social aspect, people, friends, culture, and then the norms and everything. They play a role in affecting or in causing personality disorder. And then we have the interaction. You see, with the interaction, that is interactions between the biological, the psychological, and the social factors has a way of what causing what personality disorder. Then we move on to the treatment of personality disorder. So how do you treat them in case there's someone having some this personality disorder, someone like antisocial, avoidant, all these personality disorders, how do you treat them? First, you have what we call the psychotherapy. So in simple terms, what I can say about this psychotherapy is the talk therapy. and then it is the primary form of treatment. So you see, there are some treatment that you have to, a therapist has to engage you into a talk, into a conversation to know what actually is wrong, and then gives you some guidance so that you'll be able to fight that kind of disorder. Are we together? So if you're having that kind of avoidant disorder whereby there's the fear of judgment, if you engage a therapist, you get it, that therapist will guide you in a talk, in a conversation, in a counseling section, guide you to know the ways that you have to pass or the skills that you have to develop to treat those personality disorders. Are we together? And then we are having what? The medications. Even though we are not having specific medication for some this personality disorders, but there are some drugs that at times they use these drugs to avoid depression, and also to stabilize some other kind of personality disorders like depression, anxiety, and anger. Yes, you see, at times someone, I remember someone told me that if you know that you get angry, is the moment you're about to get angry, or the moment you get angry, drink cold water to suppress, or like to just to stabilize it. You get, so it's a form of medication that this particular person is what giving to me. You get it. And then we are having challenges. So you see, treatment can be long term, intensive, challenging due to the ingrained and egocytonic nature of patterns and the individual potential resistant to change. You see, the challenges that at times what you can use, that you have to approach or you have to treat them with challenges. So in case they, you see, there are some people it becomes very difficult for them to change. So how do you make sure that these people embrace change? It comes with challenges, making up that there are some treatment become long term, and then when these treatments are just long term, it creates a certain form of challenges. Are we together? Yes. And then we talk about the personality assessment. So we are having the projective test. That is the ambiguous stimuli designed to review unconscious thoughts. And then you all know that we have already discussed that stimuli is something that can easily elicit a response, something that trigger a response. It's the stimuli. Are we together? Yeah, so projective test is like, you see, there are some tests that you go through, and then these tests actually triggers you so that those unconscious thoughts that you have actually forgotten, it will be able to be reviewed in order to find out what is actually wrong. I reach again. And then I don't know if most of us really watch those American movies. Yeah, at times when they want to find out the deep thoughts of into someone's childhood experience, they have machines that they use, they insert it maybe in your brain or something like that, and then they use that to trigger that unconscious thoughts. You get it. And then we have self-report inventories, and then with these self-report inventories, they are the standardized, and then where individuals respond to statements about themselves. So it used to measure traits, behaviors, and what psychological condition. We have behavioral what assessment. And then with this behavioral assessment is observing and recording behavior in specific what situations. Are we together? Good. And then we move on to phobias. So with phobia is an intense irrational fear of a specific object, situation, or activity that poses little to no actual danger. Yes. The fear is typically disproportionate to the actual threat and leads to significant distress or avoidance behavior. So phobia, you see, sometimes the irrational fear. When we talk of irrational, it's not like the rationality of you being fearing something, you get it? But the irrational, any small thing that you know that this actually is not something that you should be afraid of, but to you is an intense and irrational fear of that particular thing. That make it a phobia, something that you are afraid of. So, for example, you're afraid of cockroach. Anytime you see a cockroach in your room, like, are we together? Like, you shout and then you are trembling in fear, seeing a cockroach in your room. You get it? Yes, it is some kind of irrational fear because they pose no threat, or there's no like they have no actual dangerous thing to cause to you. You get it? And then you have some notable phobias. You have the acrophobia, the fear of heights. So people, those that they will actually, when you take them to tall building, they usually panic. And then they are afraid of, even if you tell them to look down at that very tall building, they are very, very afraid. To call those people acrophobia. That's the irrational fear of heights, the fear of heights. And you have the arachnophobia. That is an intense and irrational fear of spiders. Those that are fear of spiders. Yes. In case you see a spider in your room, you start shouting Jesus. You can even shout and mention everyone's name here. So having a fear of spider is called the arachnophobia. And then having the claustrophobia, that is a fear of enclosed spaces. You get it? Yes. You see, there are some crowded rooms, maybe airplanes, small cars. Those that are afraid, especially anxiety in elevators. You get it? That's an enclosed space that you find yourself into. When you're having that fear, we call it what? Claustrophobia. And then you're having agoraphobia. That is a fear, the fear of, like, you are afraid that there are some situations and the help is unavailable. Maybe in a prison, you have the fear that this place is not possible for you to escape, or maybe the fear, the panic that you experience when you find yourself in a situation that you think that it might be difficult to get help. I reach together, we call that agoraphobia. And you have the opidophobia. That is an irrational fear of snakes. Those who are afraid of snakes, even though they pose no actual threat to you. At times you see the snake is either you run from the snake, or maybe the snake also run from you. You get it? Yes. And that is, those that are afraid of snakes, we call them opinophobia. And then we're having cynophobia, an intense fear of dogs. Those who are afraid of dogs, that is the name that has to be given to you. This phobia can significantly impact a person's life, as encounters with dogs are common. And then you have the trypanophobia, that is the fear of injections. Those who are afraid of injection, especially when you go to the hospital, and then instead of them to inject you, you rather say you want drug. Why? Because you are afraid of injection. Yes, for you, we call you someone who fears, or the severe fear. It's not just a fear. I know that everyone fear injection, but the severe, the intense of it, yes, that is the trypanophobia. And then you're having aerophobia. So with this aerophobia, an intense fear of flying, especially when you are those that I know there are some people, it's their first time taking a plane, and then when the plane takes off, they are very afraid, that fear of flying. You get it? Yes. And especially maybe you find yourself, I don't know if some people have been to places to explore, and then you have been in a parachute before. Actually, I've not been in a parachute before, but I'm just using that as an example. You have been in a parachute before, and then the fear of you flying high. You are trying to think of how are you going to get back on earth. Those kind of fear, that intense fear. You get it? That's the aerophobia. And you have the astrophobia, a fear of thunder and lightning storms. The moment it's raining, and then you, like, a thunder just strikes. Come on, you just run, and then you run to your bedroom, then you just stay at a particular side of your bed just to make sure that you are not scared, or maybe everything's okay. Yes, so if you are afraid of thunder and lightning, that is astrophobia. And then you're having mysophobia, that is the extreme or the irrational fear of germs. Yes, you see, there are some people, like, every place they enter, they want to wash their hands. I don't know if you have actually encountered some people before, these people before. Like, maybe in case they greet after greeting everyone, maybe not even after greeting everyone, maybe after greeting each person, the person will have to use sanitizer, and then before he greets the next person, you see, they have that intense fear of germs, like they're afraid of germs, and then contamination, and then that they will enter their body and stuff. Are you together? Yes, that is it. So this brings us to the end of our lesson for topic 2, that is personality. And then we are going to continue with the next topic, that is human development, in our next video. Thank you very much. This is grade 8 tutor. Don't forget to subscribe and share this video to your friend as well. See you in the next video.